Hello YouTube, return sex, beauty and confidence, what operations help to recover after childbirth? Of course, the birth of a child is a real happiness, but many women after childbirth face numerous problems in everyday and intimate life. Dramatic changes in the body or significant weight loss often lead women to decide to undergo a series of surgeries in order to restore the figure they had before pregnancy. Do women really need plastic surgery in order to regain their self-confidence, says the candidate of medical sciences, a surgeon of the highest category of the plastic surgery clinic. What is mommy makeover? This is an individual complex of surgical interventions aimed at restoring the female body and its contours after pregnancy. More often, the complex consists of the following operations: breast lift, abdominoplasty, liposuction, intimate plastic surgery. These operations in one complex procedure lead to an incredible transformation. However, this combination of operations requires great skill and attention to detail. It should also be remembered that the reincarnation scheme for each patient is built individually and can change this combination in accordance with their needs. Let's consider each operation separately. Lifting and breast augmentation. After breastfeeding or sudden weight loss, women are often left with saggy breasts. The breast augmentation procedure eliminates such a cosmetic problem, reshaping the breasts and giving them volume through fat transfer or implants. According to certain individual indicators, the doctor may advise you to perform a breast lift. This surgery also allows for a more youthful appearance as the areola, the pigmented area around the nipple, returns to the center of the breast. You can combine all these procedures if you wish. Abdominoplasty. After childbirth, not only the chest, but also the stomach lose their tone. The process of natural childbirth leaves excess skin around the abdomen and weakened muscles. A tummy tuck, also known as an abdominoplasty, addresses both problems by removing excess skin and fat from the area and tightening the muscles. As a result, women can get a flat and toned stomach. Also, often after childbirth, you can find strong manifestations of diastasis, which negatively affects the life of a woman. This is a divergence of the right and left rectus abdominis muscles in proportion to the white line, the fibrous structure of the anterior abdominal wall, located in the middle. It occurs if the muscles do not return to their place soon after childbirth. Intimate plastic. Dissatisfaction with the appearance of the genitals can lead to discomfort, loss of libido, and the rejection of intimate life. Often women lose self-confidence, complain of pain during intercourse and urination. A change in the shape of the labia makes it difficult to wear good underwear and tight clothes, and a depressive mood often develops. But even in the absence of pain and discomfort, a large number of women go to the doctor to restore the aesthetic appearance and smartness of their genitals. After the procedure, the anatomical structure of the genital organs and lips is preserved, sensitivity increases during sexual intimacy, and healthy muscle tone returns. Labioplasty. During labor, it is the labia minora that experience the greatest stretching. They begin to sag and increase in size. In this case, resection of part of the tissues will help, the operation of partial removal of the affected organ. Through the operation, it is possible to preserve the structure of the labia minora. Regarding the plastic surgery of the labia majora, it is performed much less frequently. Indications for surgical intervention is the loss of the size or tone of the huge labia. Why procedures are performed in a complex? The complex is a time saver. With the simultaneous implementation of all procedures, the stage of postoperative recovery is reduced, and this allows you to reduce the load on the body. How long does rehabilitation take? Rehabilitation lasts a little longer than after each of these operations separately. It consists in limiting physical activity for a month, wearing special compression underwear in the chest and abdomen. Result: the figure visually looks harmonious, regardless of the number of pregnancies. The advantage is that you only go through rehabilitation once, and not after every surgical intervention. When can I have surgery? It is usually recommended to do the operation no earlier than 6 months after the end of feeding. That's how much the body needs to recover from birth stress. This operation is also recommended to be done when your weight has reached the best indicators, close to maternity. And yes, after mommy makeover you can give birth again, but do not forget that the next pregnancy will affect the result of the operation. Thank you for your time and attention listening to me. Don't forget to hit the like button and subscribe to our channel. You can also click the bell sign to be informed about new videos. Have a great day.